Welcome to the Omnidental Podcast. Today, we are undertaking a deep dive into something, something you might think is simple, but is secretly a fascinating chemical challenge. Dental sealants.
There's a lot more to them than people think.
Exactly.
Yeah.
For the millions of children and adults who rely on them, they're just a protective barrier against cavities.
Sure, a simple shield.
But for us, the real mission here is to move past that simple definition, that protective layer,
Right.
and really explore the surprising material science that dictates their effectiveness.
And to do that, we're looking at research that informs modern preventive care, a lot of insights compiled by the team at Omnidental and MedSpa.
Right.
And for context, Omnidental, which is led by the very experienced Dr. Belis Poles, is located in Arlington Heights, Illinois. They serve not just that community, but also, surrounding areas like Buffalo Grove, Palatine, Schaumburg.
And what I find interesting about Omnidental's approach is that unique blend of advanced health services. They are experts in general, cosmetic, and advanced dental implants, sure, but they integrate that with a whole range of aesthetic services.
Yeah, everything from injectables and skin treatments to body treatments.
It's a really holistic view of well-being, which brings us perfectly back to, the most basic form of prevention, the dental sealant.
It really is the ultimate preemptive strike against decay. Simply put, dental sealants are just thin, custom-fitted coatings that are applied to the deep, narrow grooves on the chewing surfaces of your back teeth.
The molars and premolars.
Exactly.
I always think of them as specialized raincoats for your teeth.
That's a great analogy.
Because the surfaces of our back teeth are so complex, right? They're full of these little traps where bacteria can settle, even if you're a diligent brusher.
That analogy is perfect because it really highlights the necessity. I mean, the numbers on tooth decay are startling.
Yeah.
That's why sealants are so critical, especially in pediatric dentistry. Our sources note that 42% of U.S. children between 6 and 19 have tooth decay in their permanent teeth.
42%.
What? And right here in Illinois, it's even higher. 66% of third graders have at least one cavity.
Those are stats you really have to actively fight.
You do.
And the fight is clearly effective with this material. We see that when sealants are used with good oral hygiene, they prevent a massive 80% of cavities.
And that's just during the first 2 years.
Right.
They offer tremendous long-term value, too. They continue to protect against 50% of cavities for up to 4 years. So they aren't just a temporary fix. They're a long-lasting strategic defense.
Okay, so let's unpack this. If these coatings are chemically capable of, repelling decay for years, the core question has to be, what are these things actually made of that makes them so robust? I mean, we have to assume it's not just some kind of glorified nail polish.
No, not at all. It's highly specialized material science. The dominant type of sealant used today is the resin-based sealant. This is a composite resin, often tooth-colored so it blends in, that forms an incredibly tough, durable polymer shell.
When you say composite resin, what exactly is holding it together? Because a tooth has to withstand hundreds of pounds of pressure. It needs to be stronger than just plastic.
That's a great question. And that's where the fillers come in. The composite resin base isn't applied by itself.
Okay.
It incorporates these small, incredibly hard filler particles. You can think of them like microscopic gravel mixed into cement.
So what are these fillers made of?
Typically materials like glass or quartz.
So the glass quartz, they're not just for show. What's their specific function beyond just being hard?
Well, their role is multifaceted. They dramatically increase the material's compressive strength and its resistance to abrasive wear.
Which is essential since those back teeth are grinding food constantly.
Constantly. And what's more, they actually reduce the shrinkage of the resin as it hardens.
Oh, interesting.
Yeah, that ensures a really tight seal against the tooth, and it creates a smoother surface, which is, of course, easier to keep clean.
That structural integrity makes sense. And as we've talked about, this type of sealant needs a specific step during the application that ties right into its chemical makeup.
Correct. The resin-based materials, they're light-cured, so they're placed in a sort of semi-liquid state, and then the dentist uses a specialized high-intensity light.
The curing light.
The curing light, yes. And that light triggers a rapid chemical reaction, instantly hardening the material into that final durable barrier that locks bacteria out.
Okay, so this is where the conversation gets really nuanced.
It does.
Because when you start digging into the chemistry of some of these resin-based materials, you find a familiar industrial chemical, one that causes a lot of concern for a lot of people, bisphenol A, or BPA.
This is a critical point, and it really requires careful clarification. For background, BPA is an industrial chemical that's been used extensively since, what, the 1960s?
Right, in things like hard, clear water bottles.
Polycarbonate plastics, yeah. And in epoxy resins, which are used to line food cans to stop corrosion.
So when people hear that chemical name associated with something going in their mouth, they immediately worry. Is BPA an ingredient that's intentionally added to these sealants?
No, not directly, and that's the key. The source material clarifies that some resin-based sealants may contain trace amounts of BPA.
Trace amounts.
Yes. It's not usually a direct ingredient. It actually appears as a minuscule byproduct or impurity that comes from the breakdown of the resin's foundational chemical structure, from what are called resin monomers.
You used a technical term there, resin monomers. Can you simplify that for us? How does a byproduct accidentally show up?
Sure. Think of monomers as tiny, individual chemical building blocks. The hardened plastic is formed when all these little monomers link together in these really long chains, which are called polymers.
Okay, like a chain.
Exactly. When that chemical linking process or polymerization happens, sometimes a tiny amount of residue or an unreacted trace like BPA is left over, or it can leach out just briefly after placement.
So it's an unintended residual element, not something added for performance.
Precisely. It's not a functional component that was put in there to make it stronger.
Given all the discussion around BPA in food packaging, what's the scientific consensus on the safety of these tiny trace amounts in dental sealants? Is the risk negligible?
That is the key safety context here. Numerous rigorous studies indicate that the minute amount of BPA that's released, which typically happens just in the first few hours after application, poses no significant risk to overall health.
So the exposure is very short-lived.
Very. And it's dramatically lower than the daily exposure limits that are set by regulatory bodies. Research is ongoing, of course, but the overwhelming data supports the safety of using these highly effective sealants.
That is a crucial distinction. We're talking about trace, fleeting amounts versus, say, continuous exposure from food packaging.
Exactly.
But let's assume a listener is still focused on elimination. If a patient or a parent is committed to a guaranteed BPA-free option, what does the science offer as an alternative to this resin material?
That's where we turn to the second major category, glass ionomer sealants.
Glass ionomer. Okay, so if they aren't resin-based, what is their chemical composition?
They're chemically very distinct. They're primarily composed of a blend of fluoroaluminosilicate glass powder.
That's a mouthful.
It is. And an aqueous solution of polyacrylic acid. When you mix those two, they react to form a cement.
And by their nature, they're completely BPA-free.
Completely. That's the main advantage for people who are concerned about that.
So we immediately check the box for those looking for a material without any of those potential chemical byproducts. But the glass ionomer has another unique benefit, doesn't it? Something that resin sealants don't have.
Absolutely. And this is their major scientific advantage. The fluoroaluminosilicate glass component allows them to actually release fluoride ions slowly over time.
Oh, that's interesting. So it's an active material.
It is. The fluoride gets absorbed by the surrounding enamel, which helps to remineralize the tooth and actively make it more resistant to acid attacks and decay. It's not just a passive shield.
Okay, so if the glass ionomer is BPA-free and it releases fluoride, why wouldn't every single patient just choose that option?
Yeah.
Is the durability difference really that significant?
And that is the essential trade-off in material science right now.
I see.
The glass ionomer sealants, they're chemically sensitive to moisture, and crucially, they are generally not as durable or resistant to high chewing forces.
Not like the composite resins.
Not at all. They're much more susceptible to wear and chipping, which means they often need more frequent monitoring and, well, replacement.
So a dentist is balancing two powerful options. On one hand, you have the highest possible long-term mechanical durability from the filler-enhanced resin, which has that trace BPA. And on the other, you have a BPA-free active material, the glass ionomer, that releases fluoride, but it might need to be replaced sooner.
You've synthesized the dilemma perfectly. It really depends on the specific tooth, the patient's age, their risk of decay, and, the amount of force on that particular chewing surface.
Let's connect these materials back to the chemistry of how they're applied. The success of both materials really relies on getting a perfect bond with the tooth, which brings us to the crucial step of the acid etch.
The preparation is everything. After the tooth is thoroughly cleaned, the acid etch, which is usually a phosphoric acid solution, is applied. And this step is a little chemical marvel. It delicately demineralizes the enamel surface, creating this microscopic porous network.
That sounds aggressive, but it's intentional. It's not just roughening it up, is it?
No, not at all. It's creating millions of tiny microchannels or mechanical interlocks. So when the liquid sealant material is painted on.
It flows into all those little channels.
Exactly. And when it hardens, whether it's by the curing light for the resin or the chemical setting for the glass ionomer, it locks into the tooth structure. It forms a bond that's both chemical and mechanical.
And that mechanical interlock is what ensures the raincoat stays stuck for years.
That's right.
And the evolution of these materials, it's been remarkable. We are using solutions now that are vastly superior to what was available even, 20 or 30 years ago.
Absolutely. Early sealants were often prone to leakage and rapid wear. The development of these modern, highly filled composite resins and the introduction of advanced glass ionomer cements have fundamentally changed prevention. They offer superior wear resistance, better bond strength, and critically, longer-term effectiveness.
So what does this all mean for you, the listener, taking this deep dive into preventative care?
I think the final key takeaway is that prevention isn't monolithic. Understanding the composition, recognizing the difference between a high durability composite resin reinforced with quartz versus a fluoride-releasing glass ionomer. It empowers you. It helps you appreciate the specific protective roles these specialized materials play. It turns a simple dental procedure into a real conversation about material science and personalized health choices.
And as we noted at the top, Omni Dental and MedSpa emphasizes their commitment to using advanced technology and also operating as an environmentally conscious dental practice.
Right.
This effort towards sustainability will inevitably influence future material development. So this raises an important question for you, the listener, to maybe explore on your own. As the demand for both non-toxic materials and maximum durability continues to rise, how will material scientists and dentists innovate? How will they create the next generation of sealants that are even more effective, more environmentally sound, and maybe eliminate those lingering chemical trade-offs for good?